Case study: Understanding the drawer sign in knee ligament injuries for primary care practice. Introduction. The drawer sign is a crucial clinical tool for primary care physicians in the evaluation of knee ligament injuries, specifically those affecting the anterior cruciate ligament, ACL, and posterior cruciate ligament, PCL. Its importance in early diagnosis and management makes it a vital aspect of knee examination. Description of drawer sign. The drawer sign comprises two tests. 1. Anterior Drawer Test evaluates ACL integrity. A forward sliding of the tibia indicates potential injury. 2. Posterior Drawer Test assesses PCL integrity. Backward movement denotes potential injury. Clinical importance for primary care. 1. Early diagnosis helps in the early detection of ACL and PCL injuries, which are common in both athletes and the general population. 2. Assessment tool, a valuable part of the knee examination, enabling a focused approach. 3. Referral decision, guides the decision-making process for specialist referral or imaging. 4. Management of sports injuries, useful in managing sports-related knee injuries, a common complaint in primary care. 5. Coexisting Injuries Awareness, the presence of ACL or PCL laxity may suggest other ligamentous or meniscal injuries. 6. Consideration of patient's activity level, helps in considering treatment options based on the patient's lifestyle and activity demands. 7. Potential misdiagnosis, requires caution as other knee joint pathologies may mimic the drawer sign. 8. Technique importance, proper positioning and technique are vital for accuracy. 9. Chronic injury awareness, chronic ACL or PCL laxity might present with secondary osteoarthritis. Statistics. 1. Incidence. ACL and PCL injuries represent a significant proportion of knee ligament injuries. 2. Demographics. More common in young and active individuals but can occur at any age. Historical perspective. The drawer sign remains a traditional orthopedic test, reflecting its continued relevance in modern primary care practice. Diagnostic approach in primary care. 1. Clinical assessment, a thorough history and physical examination. 2. Imaging, referral for MRI for definitive diagnosis. 3. Referral to specialists, consideration for orthopedic consultation. 4. Conservative management. Initial management may include rest, ice, compression, elevation, and physical therapy. Conclusion. The drawer sign's application in primary care extends beyond mere diagnosis. Understanding its nuances can guide primary care physicians in appropriate management, referral, and patient counseling. Continuous education and skill refinement in performing the drawer sign can significantly impact patient outcomes. Where to find more info: family medicine textbooks, sports medicine guidelines, and continuing medical education, CME, courses on musculoskeletal examination offer in-depth resources.